Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loibol, and this week we are talking about the most common genetic kidney disease. Dealing with autosomal dominant polycystic kidney disease, or ADPKD. I've been playing a lot of cards lately, and sometimes you just get dealt a crap hand. Of course, the responsible thing to do is fold, but sometimes you just have to hang on and hope something lucky will come down the river. Progressive genetic kidney diseases can feel like this as well. Your genes determine how some diseases will develop over time, and there's not much you can do but hold on and hope science comes up with a solution. With autosomal dominant polycystic kidney disease, good cards are starting to show, and hope may come with successful clinical trials. Autosomal dominant polycystic kidney disease, or ADPKD, is the most common hereditary kidney disease, but is still rare, affecting only 1 in every 1,000 to 2,500 people. It is a genetic disorder where a single mutated gene causes fluid-filled cysts to form in the kidneys before birth. Over time, these cysts fill with fluid, causing the kidneys to grow from the size of a fist to that of a football, which damages kidney tissue and impairs kidney function. Because cysts take time to grow and the kidney compensates for damage, many patients have no signs or symptoms until their late 30s or beyond. By age 70, a majority will need assistance with their kidney function. But, as Dr. Shabib states on the MedEvidence podcast,
it's considered a relatively good prognosis in general if we take the big picture. Our ADPKD patients, if they have health care and they take good care of themselves, they should live normal life.
Mm-hmm. Genes determine who gets ADPKD, but how? 2 genes, PDK1 and PDK2, encode proteins that change signaling pathways. These genes are active before birth in kidney cells and are responsible for normal cell processes like fluid transport, cell specialization, forming new cells, cell death, and attaching to neighboring cells. When a fetus has a dangerous form of PDK1 or PDK2, cells errantly form the tiny, fluid-filled cells characteristic of ADPKD. The exact mechanisms for how cysts form and grow are complex, but include signaling molecules, immune cells, and enzymes. Disrupting these activities may cause the cysts to metaphorically fold and slow the progression of ADPKD. Slowing cyst growth is a good bet for good outcomes, as pushing the need for kidney assistance from 70 years old to over 100 would make the drawbacks of this disease moot. Large cysts damage the kidney's main function, which is to filter blood. Cysts can also cause abnormal connections among cells, metabolic changes, increased blood pressure, kidney stones, and damaging inflammation. Stacking on this, the cysts can become infected or rupture, causing pain and or blood in the urine. Outside the kidneys, increased blood pressure and decreased kidney function can deal downstream damage, including to the heart, brain, and liver. This may sound like a wild amount of problems, but doctors and scientists have been raising our ability to slow cyst growth and mitigate ADPKD's effects. The king of ADPKD management is a healthy lifestyle, including extra water, aiming for between 100 ounces and 1 gallon per day, less salt, under 2.3 to 3 grams per day, moderate amounts of protein, between 0.8 and 1 gram of protein per kilogram of body weight, which is about 60 grams for a 150-pound person, maintaining a healthy weight, moderating calories, and aiming for normal BMI, quitting smoking, and exercise. Beyond lifestyle changes, medications can chip in to help. Keeping blood pressure under control is very important, and maintaining healthy cholesterol levels is recommended. Doctors may also prescribe the only currently FDA-approved medication, tolvaptan, also called GnRQ. This suppresses one of the critical signaling molecules involved in cyst growth, helping to slow the progression of the disease and protect kidney cells. Side effects and drug-to-drug interactions make tolvaptan difficult for many patients to tolerate, so new therapies are a high priority. Luckily, the ace in the hole for ADPKD patients is clinical trials, which are drawing new treatments closer than ever. On the near horizon, medications targeting cyst growth are expected to enter clinical trials soon. A little further out, treatments are looking at solving the underlying genetic issues caused by faulty PDK1 and PDK2 genes. When combined with disease-altering medications and a healthy lifestyle, clinical trials will leave ADPKD patients flush with treatment options. What a deal! Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.